Some people ask whether you can catch the flu from having a flu vaccination, and this is a myth. There's no way you can catch the flu from the flu vaccination. The vaccination that we use is an inactivated virus, which means the virus is dead. So we're not giving you an infection with the immunisation, so there's no way you can actually catch the virus. The issue is though, a lot of people will say, oh, they had the flu needle and then a few days later got sick. And the trouble there is that we give the flu needle in winter when there's a lot of colds and flus spreading around anyway. And so a lot of people will catch a cold and it just happens to be a few days after the flu needle. But the flu needle itself can't give you influenza. Some people say young people don't need to get the flu needle. And I'd probably put this as a fact. If you're young and healthy, you don't need to get the flu needle. But if you want to prevent yourself from catching the flu, potentially missing time off work and being sick for a week, then you're certainly able to get the flu needle and it can help you stay healthy during winter. Some people ask, flu symptoms include gastrointestinal symptoms? And the answer is yes. And in fact, it's more common with influenza than the common cold to get gastrointestinal symptoms like feeling nauseous or even vomiting. So it is a common part of influenza. Some people will talk about stomach flu, and really they're talking about a viral gastroenteritis. So if your only symptoms are things like diarrhea and vomiting, that's not influenza. But if you've got cough, runny nose, fevers, aches and pains, and you're feeling a little bit sick in the stomach, then that all can be due to influenza. Pregnant women can't get the flu needle. Well, this is very much a myth. The flu needle's been given to lots of pregnant women and it's been shown to be perfectly safe. More importantly, we know that women when they're pregnant are at more risk of getting severe influenza. And so getting the flu needle in your pregnancy is the best way to protect yourself and your unborn child against becoming very unwell during your pregnancy, which is a risk to your pregnancy and your child. Some people say you can avoid the flu by washing your hands regularly. Well, this is an absolute fact. By washing your hands at least 5 times a day, you can almost halve the risk of getting influenza. So it's a very simple way to reduce your risk of influenza. If you can't wash your hands, then using the antibacterial washes or wipes is another option to reduce your risk. People ask, if you get the flu, then did the influenza vaccine not work? This is a more complex question. The answer is yes and no. So sometimes we give the flu needle. If you'd already been exposed to the influenza virus, then you may still get the flu because the flu needle takes 1 to 2 weeks to start working. So you can get a flu after you've had the flu needle. A lot of people though often think they've caught the flu after an immunisation, but in fact what they've caught is a common cold. And it can be very hard to tell the two apart with absolute certainty without doing tests to prove what infection you've got. And the last issue is that the flu needle isn't 100% effective. We know that it probably only reduces your risk by about a half in terms of getting influenza during the winter season. So the answer is yes, you can get the flu after you've got the influenza virus vaccine, but it does reduce your risk of getting the flu. So the question is whether getting the flu vaccine will compromise your immune system over the longer term, and are you then more at risk of getting influenza in the future? Well, the answer is no. The evidence is that if you get the flu vaccine every year, in fact, in subsequent years, you're still slightly less likely to get influenza than those people who never got the flu vaccine in the first place. And the other important point is that you don't want to get influenza. Influenza is a severe disease. And for a healthy young person, that might mean they're just in bed for a week and then recover. But if you're someone who's at risk of severe disease, there's a mortality associated with getting influenza. So the first point is that I wouldn't want to get influenza. Second point being, if you get the flu vaccine, you will still get ongoing protection against influenza, but your best protection is getting the flu needle every year, because the flu virus changes. Each year there are different strains that are circulating around that are the most likely strains to cause illness, so we change the vaccine every year to match those strains. And the vaccine that you get starts to wear off over time, so the best option is boosting it every year. Some people ask, if you have a high fever for 1 or 2 days with the flu, does that mean you need antibiotics? And the answer is not necessarily. Influenza is a severe disease where you often are going to be sick for up to 7 days with the illness. So the fever by itself isn't an indication for antibiotics. But if you've got the flu and you're feeling a bit sicker, you've got ongoing fevers, you're coughing a lot and you're unwell, that would be a sign to me to go and get checked whether you've got a complication of influenza. So influenza increases your risk of pneumonia, and as a doctor we can listen to your chest and make sure that you don't have one of the complications of influenza. If you develop pneumonia, that would be an indication for antibiotics in that situation. But unfortunately, influenza is a severe disease where you'll have fevers for a number of days. That by itself doesn't need antibiotics, but it's hard for you to know whether you've got pneumonia or other infections. So if you're feeling really unwell, you should come to your doctor and get checked.